I believed once I got into medical marijuana with a personal experience with my son, and then that led to my writing the book, Marijuana, the Forbidden Medicine. I still believed it would be possible to have it available as a medicine. And I'm not talking about a pharmaceutical product. I'm talking about herbal marijuana, which is the gold standard as a medicine. That it would be possible to do that if, even though we continue to have a prohibition. I'm now convinced that that's just not true. I used to believe if we could just get it moved from Schedule 1 to Schedule 2, we would then be able to do the clinical studies and demonstrate how useful it is in so many different symptoms and syndromes, and that it would establish itself as clearly the least toxic substance that one can use as a medicine for many of these symptoms and syndromes. I'm now convinced that that's not possible. You can't do it while it is prohibited. You can't use it as a medicine while it is prohibited for other purposes. Look what's happening in California, where they're arresting patients, closing down growers, and so forth. It just won't work. As a medicine, it would be the equivalent of an over-the-counter medicine. I mean, you have the right to decide whether you're going to use aspirin or Tylenol or something else for your pain. You should also have the right to choose cannabis, which in some ways is better than even the ones I mentioned because it's less toxic. 1,000 or 2,000 people die from aspirin every year, not a single death ever from marijuana. And you would also, it would allow patients to titrate their own doses, which is a phenomenon which is just underappreciated, because when your doctor arbitrarily says take 2 aspirin, he doesn't know what the dose, what dose you really need. You as a patient can titrate it just to the point where you get rid of the nausea, or you get rid of your headache, or your cramping from Crohn's disease goes away, or you regain your appetite with it. You can do that. A doctor can't do that. He can't tell you what to do. You can do it. So, you know, just as its renaissance as a medicine began, the people's. It began with the people. These anecdotal accounts come with the people. It is a people's medicine. It will always be a people's medicine. Now, I don't for a minute believe that the pharmaceutical industry can come up with some things which are superior in some ways. But it has to be tested. They have to prove that it's superior to the leaf, to herbal marijuana. And if they do come up with things that are better, let's say, imagine some pharmaceutical company developing a reverse agonist for the munchies effect. In other words, something that would actually reduce appetite without it being toxic, like all the other things that we try to use for reducing appetite to control obesity and so forth. Now, if somebody could do that, they would make a fortune, that pharmaceutical company. No problem with that. But it must be that people have access to marijuana, herbal marijuana, as a medicine, or for what I think there are 2 other categories: recreation, a much better recreational drug than alcohol, no hangover, no violence, no driving crazy and so forth, and also what I call enhancement. A website I have is to help people understand that it isn't just for medicine and for recreation, but it helps lots of people.
That's what's the name of that website? Cannabis Cures, is it?
No, enhancement.
Is it another website?
It's marijuana-uses.com. And it's essays from people like Carl Sagan wrote an essay on how useful it is to him in his writing. Allen Ginsberg, lots of people you've never heard of. Just write in, I'm a musician, I use it, so forth and so on. Because that's a real use for it. I think young people who are more interested in partying don't get into that. But and I think it takes some experience with it, you can find that it may enhance certain personal capacities in a way nothing else has done.
Thank you very much.
Enough?
How do you, how do you think they received you today, your testimony? How do you feel about the committee?
Well, I think the committee was really a little indifferent that I emphasize the medical aspects, but I think it's important that people realize you can't fool around anymore. Proposition 216 was very important in 215 in 1996, but that's just tinkering with it. Ultimately, if you're really going to let people explore the full medical potential of this, you can't have a state saying you can only use it for debilitating disease, and you've got to let them explore and let them consult with people who know that it is useful for things as improbable as premenstrual syndrome. Women, since Queen Victoria, as I told the committee, have used it for that. And even for things like intractable hiccups. There are people who find, I'm getting to sort of the far end of these things, but the point is, it's a remarkably versatile medicine. And since I always, as a physician, I always said to my patient, look, I don't know if it will help with your ulcerative colitis. There hasn't been enough anecdotal evidence that I can get my hands on. Some yes, some no. But if it were someone in my family or myself who was suffering from your ulcerative colitis, I'd take it, and I advise you to try it, because I know I'm not going to harm you by giving you that advice. It is not going to harm you. It may not help you, but on the other hand, you may be one of those people for whom it is a real boon. And so I think it's very easy to advise people on cannabis. You're not going to get them into trouble.